The procalcitonin is extremely important marker that is used very commonly frequently in clinical practice. Now we must know that procalcitonin is highly specific for bacterial infection. So whenever we are suspecting severe bacterial infection or whenever we want to know what is the extent and severity of the bacterial infection, we can go ahead with the procalcitonin. So, why this is very important and interesting biochemical or a marker? Because procalcitonin rises much earlier than CRP, as well as procalcitonin falls rapidly than CRP. So, C-reactive protein can be called slightly inferior to the procalcitonin. Very commonly, procalcitonin and CRP both are used together to see the extent of involvement. PCT will tell that the patient has bacterial infection or not, and CRP will tell extent or severity. More is the CRP, more bad is the bacterial infection. The half-life of this procalcitonin is around 24 hours, and this is very commonly used whenever there is mismatch of clinical scenario. So if the patient has multi-organ dysfunction and if the etiology or the anatomical site is not found, we can go ahead with the procalcitonin. It can tell if procalcitonin is more than 2, it means that the patient has severe sepsis. It means that patient must have bad infection which is hiding somewhere in the body. Most of the time, it is chest infections, urine infection, gut infection, cholecystitis, or any brain infection. We always have to find the location of this infection and treat accordingly. And that is the reason why this must be considered to all the patients with type 2 diabetes mellitus or cancer or immunocompromised patients who with MODS. Because these immunocompromised patients, diabetic patients, cancer patients, as they have poor immunity, they may not have frank symptoms like they may not have fever, they may not have cough, weakness, tiredness. They may apparently look okay, but they may have multi organ dysfunction. They may have low oxygenation level or tachycardia, or they may have acute kidney injury, or they may have slightly abnormal liver function test. So, in such instances, it is always better to go for procalcitonin to see whether this patient has severe bacterial infection or not, because that way we can escalate the antibiotics and patient can be saved. Because if the sepsis worsen and if they don't get appropriate antibiotic, then patients multi-organ dysfunction, that is MODS, may worsen very rapidly. So I always consider procalcitonin for all the patients with fever and with hypotension or with MODS. Normally, the procalcitonin value is less than zero point 0.1 microgram per liter, and the procalcitonin directly correlates with severity of the infection. More is the procal, more is the chances of multi-organ dysfunction, hypotension, mortality, morbidity. That is the reason why procalcitonin value is very important. If the procal value increases from 2 to 4, it is the sign that whatever antibiotic we are giving is not helping and the patient need escalation of the antibiotic. The same way, if the procalcitonin is decreasing, then as per the culture reports or as per the duration of the treatment, if the procal is decreasing, then we can de-escalate the antibiotics from very higher antibiotics to lower antibiotics or to a narrower antibiotics. We must know that even in severe COVID or even in any severe viral infection or ARDS or pneumonia, even if the patient is dying, even if the patient has multi-organ dysfunction, procalcitonin can be absolutely normal. So, if you want to come to know what is the cause of very bad clinical status of the patient, we can do procal. If procal is high, it definitely suggests that bacterial infection is there. If the procal is normal, then we can very effectively conclude that bacterial infection is not there. It is all viral, or maybe it is or viral linked inflammatory syndrome. Very commonly, recent major surgeries or very severe trauma, severe burn, or paraneoplastic syndrome can increase the procalcitonin level from up to 2.5 to 1. In CKD patients, that is chronic kidney disease patients, they may have procal value of up to 1.8. That is very commonly maximally seen, but beyond 1.8, the values are not usually seen. So very commonly what we conclude whenever this procal value is less than zero point 0.5, we say that patient has mild bacterial infection. Whenever we see that the procal value is in between zero point 0.5 to 2, we call that patient has moderate bacterial infection, and such patient should be admitted in the hospital and treated with appropriate antibiotics, preferably injectable. If the procalcitonin is more than 2, we call that the patient has severe sepsis, the patient has chances of MODS. So the cause of patient's symptoms must be found as early as possible, and appropriate antibiotic should be initiated to cut down the sepsis. So this was all about procalcitonin today. Thanks for your kind listening.